Alrighty, so this is our first topic in what I hope to be a series of monthly kind of information discussion sessions offered to you and the greater community here. Um, I've put together a number of programs that I have found just both in my work in the clinic, in kind of these last 13, now get approaching 14 years of working with patients routinely in the clinic, kind of areas where I found a gap in our healthcare system, whether it's a gap in knowledge, kind of these missing pieces of how to translate knowledge into action, and really help each of you optimize your kind of aging process, your healthcare experience, and just helping to enable us all to live as active and healthy a lifestyle as possible. I think we would all agree that's a goal, but putting it into practice can be more challenging for a number of reasons, which we can delve into a little bit today. This evening's conversation I've titled Back to Basics because I've found that especially now in this age where technology is advancing in just a rapid way, we're now having to deal with both positives and negatives of what AI intelligence can provide us with. I think my fear as a clinician, and also as a human, is that with all of these advancements, we're also kind of furthering our own agency, our own capacity to tap into some of our natural healing elements. And I just see that as a crucial thing to hold on to and to really make sure that we all have an understanding of. I have seen this in real time with people in the clinic dealing with both acute injury, acute illness, and chronic disease processes. There has been a real loss of kind of personal understanding of what's happening in the process of giving over agency to healthcare professionals, which, of course, there's a need for that in parts of that journey, but we've lost a lot of our own control. So I want to help just to advise how to assess our own system, and then to figure out what we can do for ourselves to really help facilitate a healing process. And this can be regardless of whether or not you're going through the rehab phase for a post-surgical intervention, dealing with a chronic injury, or just wanting to be proactive about, your upcoming health in the years to come. There we go. Okay. So I like this to kind of think of this concept. The healthy man has 1,000 dreams, a sick man only one. I think we can all relate to that. If you're somebody that's gone through a period of illness, you realize in that moment how for granted we take our health, how for granted we take the capacity of our body to do everything that we ask of it on a day-to-day basis. So again, just the goal of tonight's presentation is to share with you, again, some of the driving forces behind this program. I'd like to introduce to those of you that are unaware to this point what whole picture health looks like, and then really give you some practical ways to just assess what your own health status is. And then kind of the next step there would be to look at then your fitness level. So getting a sense of like where you fall on that spectrum. I think a lot of times we're looking for an action plan without fully understanding like what we're bringing to the table to start. We'll discuss the pillars of healthy living. Um, I'd like to give an overview of metabolic health, chronic stress, and our physical activity levels and how that interplays in determining our health status. And then provide you with some feasible action steps to help optimize the process. So I've broken up the presentation into three parts. As we move from one part into the next, we'll take just a quick movement break. I know it can be kind of long and arduous sitting at the computer for a length of time. So in the hopes of practicing what I preach here in the clinic, we will get up and just move a little bit. This should run about an hour. If you have previous commitments, then feel free to step out as you need to. I am open to questions along the way, so feel free to stop me if anything really resonates with you or if you need clarification. And then we will spend some time just in open discussion and questions at the end. So the first part we were going to delve into is like understanding what the root of the problem is. And this will be done from both a macro picture, like the root of some of the gaps in our healthcare system overall, and then also looking at that root cause as it applies to us as an individual. So in order to start, we'll take a look at the framework of our current healthcare system and then just contrast and compare that a little bit with more of what's called the functional framework of health. So as I shared in our introduction to this program last month, a functional health framework is something that I was really moved to explore more. Again, based in my time with people in the clinic, I think one of the benefits of a physical therapist job is we really get to spend some quality time with the people that we're working with. I know I can speak for this in my own experience. I'm sure many of you can relate that in going to a primary care doctor's appointment, we're often really relegated to a very small amount of time with that practitioner. I think if you look at the statistics right now, it's about a 7-minute face-to-face visit. Um, so I feel some responsibility as a healthcare professional in my role to be a provider of education and information in the time that I have with clients. I don't want to take that for granted. So I tend to see people in the clinic as a reaction to an event that has happened that changes their level of function or where they're limited by pain. So as with many of the occurrences in our healthcare model, it's more of this reactive based care model. Um, our current system is very, very good at treating acute trauma, infection, injury. It's based in what's called like an episodic care model. So we have an episode, an event that requires care rather than this kind of ongoing collaborative model. If you look at the evolution of our modern day medical field, it really evolved during a time when we were trying to navigate acute infectious disease like tuberculosis, influenza, as our leading cause of death. So, unlike now, where we have our major chronic disease processes as our leading cause of death, so cardiovascular disease, cancer, diabetes. This inception of the current medical model was really under different circumstances. And so it's looking at how do we evolve to meet that change in need. Um, Based on this original model, the training as well as the practice is very focused on addressing and managing symptoms. When you compare that to more of a functional health model, we look at the root cause approach. So we're looking at kind of that, looking downstream at what's triggering these then multitude of symptoms. When we consider that 85% of chronic disease is caused by lifestyle, so diet, exercise, sleep factors, and then our environmental health, it's kind of alarming to look at that percentage. And it's important to consider that factor because it really helps to then drive home that importance or necessity of us taking some of the agency in managing our health. It's interesting if we consider what's called the mismatch hypothesis, and I'll provide some more information on this in an upcoming slide, but we're kind of existing in this state of a mismatch between our genes and our behavior. The functional model really looks at prevention and also reversal of symptoms rather than suppressing symptoms. So again, we're kind of trying to peel back the layers a little bit more. We're looking at a multi-component approach to our health. I would imagine that many of you have a multitude of health practitioners. So primary care doctor, possibly an endocrinologist, a cardiologist, maybe an oncologist. We're often kind of moving between these siloed areas of practice, and that collaboration is somewhere also that I was hearing from patients and also seeing in like my review of medical notes and visit notes where we could really help to bridge the gap in communication as well. Um, I think we leave medical appointments with a lot of information, but then aren't sure how to translate that into some feasible changes. So just to follow up, if many of you may be familiar, Daniel Lieberman worked out of Harvard. He has what's called the mismatch hypothesis, looking at our both our adherence to physical activity and also kind of how our health status is existing in the modern day. So if you study both modern day hunter-gatherer societies, like those that live in the Amazon, if any of you kind of followed the barefoot running phase of maybe about 10, 12 years ago, the group out of Copper Canyon in Mexico, there is some parallels with what we know as the Blue Zone societies. So Okinawa, Japan is one. Um, These individuals are living in a way that's still very much akin to how our ancestors lived and how our genes really evolved to live. So we were living in a hunter-gatherer society where movement was a necessity in order to stay alive. That's how we obtained our nutrition. It's how we stayed away from predators. And then we look at that in the context of modern society where both because of advances in technology, our job roles, we've really adopted a sedentary lifestyle. So we're no longer meeting that day-to-day movement quota from just the necessity of what life demands from us. So during that time of evolution into kind of this modern state, we had to walk, we had to run, we had to expend energy, but then we were able to afford to have these long rest periods and to go into what we would call a calorie surplus, taking in extra food because our lifestyle demanded so much energy expenditure. Now, if you look at modern day, we're far less mobile, and we're very sedentary, yet we're also existing in what's called a state of calorie surplus or energy surplus. When that happens, and I could spend a whole hour talking about metabolic health, we'll touch upon it today, but that can be for another time, another discussion in the months ahead. When we're living in this state of um, a calorie influx or our our energy surplus is higher, that's when we start to store energy as fat. So we don't, the amount of glucose that our body is getting from our food, we don't need because we're not, our muscles aren't demanding it. So then we start to store fat. And we can really see this present day, especially in the last few years, in the exponential increase in non-alcoholic fatty liver disease. So that's just one of many examples of how our body has an excess of calories, and then without the physical demands to use that energy, we're then forced to store it. That has all sorts of downstream consequences. So when you look at metabolic dysfunction, I know we introduced this in our intro session. So metabolic um, dysfunction relates to like how well or how poorly our body is using the energy it gets to fuel our system or to fuel our muscles, to fuel our cells. This is an area where we're seeing just increasing numbers of dysfunction. So 1 in 3 adults are considered metabolically unhealthy. This is an area where I've really started to pay attention to the research because as a physical therapist, there are direct correlations between our metabolic dysfunction and some of the diagnoses that we see in the PT clinic. So if you look at some of the headlines in the literature, we have association or high correlation with tendon injuries, specifically rotator cuff tendon and gluteal tendinopathy with metabolic health. We're starting to see just really understand the correlation between somebody with chronic pain and metabolic health. So the inflammation that is driven by the metabolic system or a poor metabolic system plays a key role in our pain processing. We're also starting to realize with osteoarthritis, much of the literature is done with OA of the knee joint, that it's not simply a wear and tear diagnosis. We're now looking at the actual cellular makeup of the synovial fluid in the joint, and we have a far more comprehensive understanding of metabolic health and its link to inflammatory markers inside the joint space. To go a step further, so we have, this real kind of conundrum of poor metabolic health, how that then is impacting a lot of these disease processes that are then impairing our mobility, impairing our level of function. And then we couple that with our movement deficit. So, as I had introduced last month, only 24% of adults meet the recommended physical activity guidelines. Um, that's alarming because I think we all have the understanding of how beneficial movement is. I think we can all agree on the importance of exercise and mobility, but then again, it speaks to that gap of how do we then put that into practice. Um, when you look at the association of sedentary behavior and sarcopenia, so that's referring to that um, age-related loss of muscle mass, large correlation there, which makes sense. Within that same context, so if we're losing our lean muscle mass, we're not utilizing oxygen as well. Our VO2 max, so how well our muscles are processing our oxygen intake and utilizing our oxygen is a key predictor of longevity, and that's another area where we're really lacking. So that speaks to our endurance capacity. Um, are we getting winded with day-to-day activities? And then we have kind of a newer concept of what's called powerpenia. I like that word. We don't think about power as something that we train or something that we really need to have as we kind of move through each decade. I think it tends to conjure up images of, let's say, the Celtics or if you've been following the tennis matches. Power is very associated with sports. But power is the number one way that our muscles respond to loss of balance and react in a fall prevention manner. So that's another area where we're not training our system properly. Just to give you a visual, because I think, we have the information, but sometimes we're different, we have different learning styles. This is always helpful to me when we look at a breakdown of the country. We can see how many um, or percentage of adults in each state are actually meeting the physical activity guidelines. So even in Massachusetts here, where if you can see, we're at the low end of the spectrum, which surprises me, but I think I'm biased as somebody that's in the physical activity and rehab space. If you look at the blue states, that's where we tend to see a higher level of adherence to the physical activity guidelines. But even there, at its highest level, state per state, is 30% meeting the guidelines. So does anyone want to venture a guess if you kind of look at the makeup of those states? So the blue states, what might, if you just think about geography or other factors, what might be a driving force as to why those states have a higher adherence percentage to the physical activity guidelines?
Outdoor sports.
Yeah, like or access to outdoor space, exactly. Whether it's winter skiing or hiking. And then just to follow up, so I think this is an area where we've really seen a lot of new research in the last 2 years. We don't want to forget about the detriments of sitting time. So there is, I think, this misconception that if you, let's say you exercise kind of vigorously for an hour a day, yet you then spend the next 6 hours sitting, that still has a very detrimental effect. So even though you're meeting some of the parameters of the physical activity guidelines, if that sedentary time is still a makeup of your day, it will counteract the benefits of that hour of exercise. So I always just want you to have that on your radar, how important it is to break up the sitting time or the sitting periods. We can't just get by with justifying that, oh, we exercised in the morning, so we're good for the day. You really have to look at breaking up those periods of sedentary time. Okay. So if we're kind of looking at the big picture, it seems a little depressing, right? So we're existing in this kind of modern space where majority of us fall into a category where we're not as metabolically healthy as we could be. We're also probably not meeting the physical activity guidelines quite to the percentage that we should. So I like to keep that in the back of our minds. And then I look at from my day-to-day approach. This is often some of the kind of feedback I'm getting when people come into the PT clinic. So people come to see me usually because they're in pain or because they've had a change in functional status. So something meaningful, um, in their ability to do something day to day or to engage in a community organization or with family members has been compromised, either by a surgery, by an injury, by a loss of function due to a chronic disease process advancing. But these are a lot of the kind of reports I get. So if you kind of read through the list with me, I was fine, then all of a sudden everything just fell apart. I woke up one day and my knee was killing me. I can't do anything that I used to be able to do. My entire schedule revolves around doctor's appointments and everything hurts. Does any of that sound familiar or relevant to any of you?
Yep.
So what I really start to hear and have heard is a lot of this is that like we're caught off guard or things come as a surprise, right? And we're lucky in that we can really get by for a long time not maintaining our status the way that we should and we can kind of our body is brilliant at compensating. Yet we can only do that for so long. At some point, the system will have a collapse. And this is usually what happens when people come in to see me, is they've reached that breaking point and some chain or some link in the system has been overstressed or overworked. Um, this then kind of led me to exploring like, okay, what's the narrative that we're telling ourselves, or what's the understanding that we all have of our individual health state or health status? And so I wanted to explore this a little bit more and then start to use that question to help guide patients a little bit better through a recovery process or um, kind of helping like lay a foundation for them to optimize their recovery or just general health status. So we then start looking for answers, right? So we have this event or we have kind of a breakdown in the system and we start to say to ourselves, like oftentimes in more of a panic state than not, like, oh gosh, I need to do something, like the time has come. And so then it begs the question, like, where do we look? And this is not blaming. I am as guilty as the next person. This is a direct product of kind of how society has approached this issue. And we all, I think, have fallen into this space. But we look for what's most time efficient and going to kind of give us the quickest result, which is often the case, very helpful. But what we miss out on is like a sustainability program. So these will often give us an immediate fix or relief, but then the same issue will arise again, often more frequently in the future. So this too, I was just seeing over and over again. Going to doctor's appointments, getting prescribed medication, being offered steroid injections. Our tendency in that moment of recognizing kind of a system breakdown is, okay, I need to see a doctor. I must be getting old, looking for answers. I need imaging, X-ray, MRI. It's driven by this fear that things will get worse. I would imagine this is relatable for most of us having gone through an experience like this. These
Mm.
are all very valid um, thought processes. But then what happens is that I think at a cost to ourselves is that we forget to really look in first. So we forget to do a little bit of self-assessment and we immediately look outwards for our solution. So we don't take a minute to think like, okay, what's our activity level? How have we been sleeping? What's our nutrition? And what's our stress levels? So if you were to do kind of a meta-analysis of chronic low back pain, which is still the leading cause of disability in this country, there is irrefutable, um, hard, concrete data that's been proven over and over and over again that acute episodes of chronic low back pain or chronic low back pain progression is directly linked to decrease in activity levels, usually a time in life when sleep schedule is very altered, nutrition is not attended to, and can often be linked to a life stressor event. So it's just really interesting because these are not the areas that we tend to go back and really review when we go through a challenge to our health system. Again, we're wired to kind of look out and to look for that fix. So this is one of those really large gaps in our behavior that I wanted to kind of both bring attention to and then also start to explore with you, with the patients I'm working with, and just start to kind of have a conversation around this. So you could argue that we take better care of our house, we take better care of our cars, then we take better care of our own body. Um, if you go
Yeah.
back to that evolutionary process, like our bodies were designed to move, yet we don't care for them as a system that needs to be prepped and primed and um, really maintained for movement. So I think of like all the things we do for our car maintenance, right? We make sure the gas tank is full. We take it for its routine maintenance checks. We rotate our tires. We get new tires, make sure our tires are winter ready. They have enough air in them. We look at our brakes and our shocks. So we have this whole routine that many of us are diligent about. Yet when it comes to doing that for our own system, we really don't do that. Okay. Just going to take a minute because this is part of what I'm trying to implement here, do a little movement stack. Um, Anyone is welcome to ask a question at this point on what we've covered. If you feel the need to stand up for a minute, please do so. Stretch out a little bit. Again, we're trying to break up our sedentary time.
It's how come it is. Yeah. Yes.
So the idea there is just step one, kind of creating that background as to how kind of did we get to this place that we are today, to paint a little bit of a broader picture of what our current health status is as a society, and then to start to get your wheels turning, like, like how much do I really pay attention to my own health status? You know, do I consider myself healthy? What is my level of function? Um, so we're going to move into part two, which I like to call we're examining the soil. Okay. So we're taking that lens and we're turning it in. This really is the crux of the whole picture health program that I've been building over the last few months. And that's rolled out in the form of both these month-to-month lectures and also the one-on-one coaching series. So examining our health status and then turning that into an concrete action plan, I think is where we struggle the most. This is really that missing link in the collaborative healthcare model. And so this is where I wanted to have a direct impact in creating this program. And then the goal, this was shared at our session last month, but just for those of you that are new to the program, the goal of this whole picture health programming is to educate the community about the pillars of health and wellness, to empower each of you to take more agency in your own health status, and then to try and enrich each of us as we move on a path towards both building resilience and thriving, not just surviving, as we move through the aging process. So the examination process is something that I think people are left to do on their own. If you think about going to a medical appointment or taking an online course, we have the information, and so now it's like, what do we do with the information? How do we actually make behavior changes? One of the issues that I see, and this kind of is a continuation from that mismatch hypothesis about how we were of how we evolved as hunter-gatherer movers to modern day society. So we've become just increasingly disconnected, both with ourselves and kind of our innate form of being and existing in nature, and even with our modern day selves. So with advancements in technology, globalization of technology and all sorts of other industries. There's incredible positives and success that comes from that, but it also comes at a cost where we've in some ways lost some of our sense of community, that support structure. I think back to like oral history and oral tradition and in story sharing, multi-generational households, and just how important that level of connectedness is for both mental and physical health. And then also looking at kind of our food system, and how that's just really far removed from, the farm to table concept of like eating as natural whole foods as possible. So we're living in this space where there is a growing disconnect. Um, when you look at some of the future proposals of health and longevity, to me, I think though it's very promising, it's also scary. So this just gives an example of there's now a lot of these practices where it's very what's called personalized medicine, individualized medicine, and I think the concept is great. I think there is a lot of promise in this more functional approach, but again, it's further driving us towards looking externally for a fix and not doing that internal assessment of what we can kind of take control over. So there's a lot of now AI powered uh, longevity tools being utilized where we're not actually going back to our basics of, are we meeting our physical activity guidelines? Are we doing our best to use nutrition as an appropriate fuel source? Are we getting enough sleep? Now, instead, we're getting marketed with these endless amounts of products, supplements, strategies that are going to fix the issue. And again, it's just that wedge of connectedness with ourselves is just it's growing bigger and bigger. So that's where my fear is that we're losing that sense of self-agency in regards to our own health. Okay, so the million-dollar question is the how of healing, right? So we have the information. I think we all agree that we know the benefits of exercise. We know that sleep is crucial. We know that nutrition is important. So then how do we actually turn this into feasible day-to-day actions that produce change? The first thing you want to do is really create awareness, and I think that has to be step one. Because when I converse with people in the clinic that are looking to, let's say, remedy knee pain, um, we've kind of skipped that step. So it's like the awareness piece is gone because we often take it for granted, and we're looking for what the action step is. But we want to really break down into more kind of sequential steps for success. Because if you jump into the action without the foundation being there, then your adherence to that plan is really going to be hard to stick to. So we want to first to create awareness. Now that means getting a better sense of what I would say knowing your numbers. So do you have a sense based on your lab work of what your health status is, what your metabolic health is? And then knowing or understanding your level of fitness. So we have a number of fitness tests or screens that we use compared to normative data that's been collected. And you can start to get a sense of, okay, for somebody my age, where do I fall on this continuum of physical fitness and health? Once we've created that awareness, then we can start to develop this sense of agency where we can take a little bit more responsibility for our day-to-day choices, and start to take back some control. Because when we're in pain and when we've had a loss of function, we lose control, and with that is fear, and that leads to paralysis of action. We can find an accountability system or buddy. I think this is a crucial part in adherence to a plan, is figuring out what works for you. And that's something that we do a lot of work on in the coaching program, is to figure out we each individually learn differently. We have different practice styles. So finding the best system for you as an individual to stay accountable to your plan. And then bringing joy and purpose back into your life and taking action. So if we want to start with the awareness piece, we want to look at our health status. So what I like to first ask, and I'll ask of each of you, is do you consider yourself healthy? Do you have any underlying medical conditions? These would include a diagnosis of one of the primary chronic disease processes, so heart disease, diabetes, Alzheimer's, arthritis, non-alcoholic fatty liver disease, cancer. This is not an exhaustive list, but just it encompasses some of the primary
Uh,
chronic disease states that many of us are living with. So when you kind of take a minute, ask yourself this question, and then you go to, okay, if yes, how are you managing? And if no, how are you preventing? So that's the first thing is we just like to take a minute and just really ask yourself, like, what is my health status? Do I consider myself healthy? Maybe you're healthy in some areas and not in others, but just starting to get a sense of like what your own perception of your health is. Oftentimes we'll be given a health, like a diagnosis. We have that label of, oh, I have high blood pressure, but it really stops at the label and we don't kind of go to that next level of processing like, okay, I have high blood pressure. So how does this then affect the rest of my system? Because we want to always keep in the back of our mind our body is a system that's operating in an environment, and there's so much we can do to make sure that system is operating at a high capacity. Yet we lose a lot of that control. Now, what does your data say? So our data, or I think of data as like our lab values, that can give us a lot of information. So I'm curious, for those of you that feel like free to share, how many of you would say if you've had blood work done in the last year that you're aware of what that blood work says, and whether it's, you're in normative values, that you have an understanding of what's being looked at, and if some of those markers are in an unhealthy range, that you have an understanding of what that means. So just something to think about. You're welcome to share if you want to. I don't know if anyone, like I know for me, I'll get my annual blood work done, and oftentimes I just kind of take it for granted. I don't go back and really look at the numbers. I think it's important. You can often fall on that spectrum where you're trending very high, yet you haven't moved into the threshold of abnormal yet. So again, we tend to ignore some of those important pieces of information. When we're looking at metabolic health, so some of the key players there are our hemoglobin A1C, our blood pressure, our cholesterol levels, our triglycerides, our waist circumference. That's obviously a non-lab item, but something we can measure. So these are the factors that help determine what our metabolic health status is. So does, again, this is just whatever your comfort level is. Does everybody here know what their A1C value is at present?
uh-huh.
So just again, I'm starting to I want to stir the pot a little bit. I want you to start thinking like, oh, do I have an understanding of what these values are? Do you know what your last A1C reading was? So just something to think about. How in touch with our data are we? Um, so then going beyond our health status, we kind of look at, okay, what's our fitness or function status? So some of the questions I like to use as self-reflection is, can I do the activities that I want to be able to do? What proportion of the physical activity guidelines am I meeting? How many hours in the day are spent sedentary? Can I get myself up and down from the floor? Can I manage a flight of stairs without max effort or exhaustion? Do I feel like I'm using upper body to pull myself up the stairs? There's all sorts of kind of these qualifying factors. Um, if you make it more personal to your own goals, Can I lift? Can I carry? Can I interact with my grandchildren? Do I have the capacity to travel? So there are some generalized questions you can ask yourself, but then you can also make them specific to what your goals are for yourself and for what you want to be able to do in the next 10 years. Um, Again, this is the awareness piece. So you want to ask yourself these questions, because this is how we start to really get an understanding of, is what we're doing on a day-to-day basis allowing our system to operate in the way that we intend it to. Because oftentimes that's not the case. And then that's where, going back to that previous slide of, you end up coming into the clinic in kind of the state of shock or angst or disbelief that some part of that link has abandoned you. And now you're dealing with pain, compensation, and a change in functional status. So in addition to doing some of these just self-reflecting questions, we also have some ways to like objectify what your fitness level is. So we have tests of functional fitness. We have what's called the STEADY algorithm, and that's a series of questions and balance tests that will put you into a category. Are you a high fall risk, medium fall risk, or low fall risk? Um, your gait speed can have um, share a lot of information about your risk of falling, and trend towards longevity, health span. Knowing your grip strength, so upper body strength. Our five-time chair rise test, or a 30-second sit to stand test. That's one of the ways we look at lower body strength and endurance capacity. Can you get up from a chair without using your hands? How many repetitions can you do? Then we have VO max or VO2 max testing. So much of the literature will identify our VO2 max capacity as the greatest predictor of our longevity. I know for myself, until I started exploring a lot of this research as it pertained to the average community dwelling adult, thought of VO2 max as an important number for athletes. But this really dictates how our system utilizes oxygen. Um, there are ways, I don't know if anyone, and this may be going way back to like high school or college, if you had VO2 max testing done, it's either on an exercise bike or a treadmill. It's pretty invasive and rigorous testing, so obviously it's not feasible to do in the clinic. But we have what are called submaximal exercise tests. So you could do a 1 mile test or a 6 minute walk test, which is what we most often do here, just for feasibility of testing. And it's just a way to give you a baseline level of information. So this would be something, I'd be interested in doing as kind of a community project, is offering fitness testing one day. So we can explore that, but it's all about gathering information. What are your lab values telling you? What are these tests of functional fitness telling you? Because once you have that concrete information, it's much easier to then put a plan in place. We're not just like shooting arbitrary darts at a target and trying to hope that we land at the right plan. Okay. So then what happens next, right? Um, I find this quote really applicable. Dr. Schweig is the co-director of the California Center of Functional Medicine. This was in his book that he wrote. People don't struggle to change because they don't know what to do. They struggle because they don't know how to do it. And I would agree. I do think there's an element of understanding the what behind what your system needs. But then where the real change will take place, that results in a positive outcome, is the how, and then creating that action plan. So that's what we're going to move into next. Um, Please feel free to ask any questions at this point. I know we're covering a lot of information. Um, Stretch, grab some water, move around a little bit. So just to recap, we have this creating awareness. So inviting everyone to kind of do a little bit of self-reflection, and just really taking some agency and looking at, okay, what is my health status? Do I have a sense of what my numbers mean? And then what is my physical fitness status? So part three, so we've gathered our information, okay? And we're going to then look at how do I turn this into an act of healing and promotion of health. This is where we want to start to explore our pillars of health and wellness. Now, I could, and I probably will in upcoming sessions, delve into each of these pillars in its own designated time slot for each. That's not what the purpose of this evening is. This is really the heart of the coaching sessions. So I help people explore what their current status is. We look over lab values, we look over fitness testing if it's been done. Um, we start to kind of narrow down some of the areas or pillars where we can focus attention. Um, so this will be a brief overview. Like I said, I think I have programming developed for each of these subsections. If there is interest, I would be happy to set up additional topics of discussion on each of these. And then again, this kind of gives you some background where the coaching will delve into. So if you're resonating with any of these subsets, feel free to reach out and I'm happy to set up a consult call with you at any point in time. So we look at our pillars. We have exercise and physical activity. We have nutrition support. We have our sleep health, stress management, and a sense of purpose or community. So that's kind of a general overlook of this kind of whole piece of the puzzle that then brings the most robust status of health. So if we start with exercise, and again, going back to that self-assessment, you really want to ask yourself, okay, if we go back to the basics, how much of or how little of the recommended physical activity am I meeting day to day? When you look again at the evidence, cardiovascular disease management, chronic low back pain management, diabetes management, the more you're meeting the physical activity guidelines, the decreased risk you have in a multitude of, there was a study just this last year looking at 40 minutes of walking a day and significant reduction in rates of Alzheimer's and dementia. So the evidence is there and it's endless, and it's probably the most concrete evidence we have consistently for management of most, if not all, of our chronic disease states. So then begs the question, how come it's so hard to stick to these principles? And it is for all of us, and there's a number of barriers. And that's where, building a community or having a kind of coach can help work through some of that. Um, but you have your 150 minutes a week of moderate intensity exercise. That's often what we refer to as zone 2 training. So exercising at a rate of breathlessness, but you're able to maintain a conversation if you were walking with a friend, if you were on a bike next to a buddy. You want to push yourself to a point of feeling like you're winded, but still able to carry on a conversation. Then we have 75 minutes of a more vigorous intensity program. This is getting that cardiovascular heart rate up into a higher zone. This is often where people will take advantage of like a high intensity interval training program. Um, you may be at a fitness level. It's all about meeting yourself where you're at, where you might not be able to push into that vigorous intensity programming yet. And that's okay. The more consistent you can be with the moderate intensity, the better. And it's better than doing nothing. Resistance training is where most people are missing the boat. So many people are getting their moderate intensity exercise via walking, biking, swimming, but they're not getting their share of resistance training. And resistance training that's dosed appropriately. Movement should be functional in nature. If you think about the things we need to be able to do day to day, so lift, carry, push, pull. We want to be able to challenge our system in a multi-planar way. So resistance training is usually a focus area for the clients that I work with. And then encompassing some form of multimodal activity, and that would include Tai Chi, yoga, Zumba, something that creates like novelty to our system. It's moving us in a way that we don't typically encounter in our day to day. That's hugely important for fall prevention because our nervous system needs to be challenged in a new way where it has to create adaptations to be able to maintain our stability in different scenarios. Again, this I can provide, this is published information for the greater community through the Center for Disease Control, looking at our sedentary time. But just for the sake of our own time, I won't delve into all the specifics. This just is another kind of visual looking at risk of that daily sedentary time to all-cause mortality. The one thing I do want to focus on here, because I think this is where a lot of people get stuck. If you're somebody that has been very inactive for a long period of time, so if we look at the graph here, the hazard ratio of mortality on the y-axis, and your physical activity has been virtually zero, the steepest change is in those early stages. So that's to say, if you're very inactive or sedentary, it does not take a lot of movement to be introduced to see a rather large improvement in all-cause mortality or decreased all-cause mortality. So that I just like to point that out because that's where people often get paralyzed in the action step where they have not been engaged in a physical activity program for such a long time that it's or because of injury or illness that it's really hard to start and it's scary to start. But just that little bit of introductory movement can create a huge change to the system. So then we have nutrition. Again, like I said, this is a really brief overview of the pillars, and this is something that we can delve into in subsequent sessions, again, if there's interest in tackling each of these in their own individual right. It's also something that we focus heavily on in our coaching sessions. So I approach nutrition in a similar fashion as the way this program was designed. So you have to create awareness first. Um, there's a lot of push in sticking to a particular type of diet without having an understanding of how your body operates, what works for you as an individual, and what your habits are. So you don't want to delve into an action without first creating an awareness of like what drives your behaviors, what drives your choices, what are your current habits. Once you build that foundational knowledge, then you can make decisions and action steps in a much easier way. So you want to optimize your relationship with food. Sometimes that very first step is actually reframing how you think about food. So for many of us, food has become this really like mindless activity that we have to do. We don't really take our time to eat. We often don't have a mindfulness practice linked to our eating habits. And we don't have an awareness of once that food comes into our system, what then happens to it. So we lose a lot of that mental connection with the process. And that can often be the biggest driver of behavior change. Phase two will then be looking at the quality of your food. So once you develop awareness around your food choices, behaviors that drive your eating habits, looking at, okay, what's the quality of the food I'm getting? And where are there areas where I can make, not eliminate, though there definitely is an elimination piece, especially if the awareness phase yields to this recognition of a lot of processed foods. Um, Obviously, that would be a prime area to look at, okay, what can I cut out? But where can you make healthy swaps? So where can we maybe substitute something that's more nutrient dense, lower glycemic load, for in place of what we're getting, um, which is often empty calories. Those calories are not fueling our system. They're not providing satiety, so we end up being hungry again within the next hour, 2 hours, and that's when we do a lot of that grazing in the evenings. Um, I think 80% of our consumption of unhealthy foods happens after 4 p.m. Um, Phase three, then we're looking at our quantity. So once we've developed, kind of gone through the awareness piece, we've looked at the quality of our food, then we're going to look at the quantity. And this would be then the step of do we want to try and create a calorie deficit? That's something that's a little more hard to attain, but you can get yourself to that stage. So all that to say, it's not about finding a particular diet. Their diets are marketed all the time. It's about looking at what's individual to you and then creating a really feasible step-by-step progression so that you can succeed in the nutrition plan. Just a few takeaways. A lot of this is already very well-known knowledge. So we have what are kind of considered in the literature as our four white poisons: sugar, saturated fats, salt, and refined starches. That would be your pastas, grains, um, sugars, baked goods. And then considering this is, I think, kind of the easiest thing to remember and one of the most important little tidbits of knowledge you can take away. The 30-30-30 rule. So 30 grams of protein per meal, 30 grams of fiber per day, and 30 minutes of movement. There's some really good new literature just in the last couple months that moving within a, a window of time after eating has a significant effect. And then this can be in the form of like 15 body weighted sit to stands or going for a short walk on your postprandial glucose levels. So that I'd be happy to share more of that information, but that's a quick, easy solution after meal to do 15 sit to stands. And you look at the effect on post-meal blood sugar is huge. So it's an easy implementation of behavior with a really large benefit. If you want to then link nutrition to our sleep habits, one of the main reasons why we have disrupted sleep cycle during the night is because our blood sugars are unstable. So just a little food for thought there. Um, Segueing into sleep health. This, again, there's so much information here. I think sleep health, it's probably fair to say that the majority of you on this call have either in the past or at present dealt with sleep issues, whether it's difficulty falling asleep, interrupted sleep, and the implications this has on our health status is huge. Though it's often the area where we just really we can't get a good grasp on how to remedy that. There's all sorts of, prescribed sleep aid in the form of medication. However, that often does not lend itself to a true sleep cycle. So we actually don't get into our REM cycle of sleep. That's where a lot of our health benefits are taking place during a restorative part of our sleep cycle. This is a great resource that I'll share if you're somebody that either reads or listens to audiobooks. It's called Why We Sleep by Dr. Matthew Walker. There's a whole plethora of information, and I just found in reading this, it was really helpful to um, kind of gain a better knowledge base for me on just how important sleep is. Creating a sleep hygiene program. That's one of the areas that we often will explore in the coaching sessions. And then moving into the final two as we wrap up here, stress management. So I'd be curious, I like to ask, when I'm working with clients is, do you have a stress management plan or a stress management program? Another area where we know the benefits, yet we often don't actually then assess like what is our day-to-day stress management programming. So for many of you, you have that awareness. We have two kind of states of our nervous system existing: in a sympathetic state, which is our fight or flight response, and then the parasympathetic system. Both are designed to be very beneficial, including our sympathetic system. That's an adaptive response. It's called like a positive stress response that we're meant to have. However, we're now really existing in a space where this has become a chronic state versus something that we move in and out of. So we have an acute stress response to a threat. That threat should then be resolved, and then we move out of the stress cycle. If you look again to that mismatch hypothesis or how we evolved, we typically would have an adaptive response to stress. And if you look at the time of hunter-gatherer existence, if there was a threat, which was often a predator, our adaptive response was to run or to move ourselves out of the situation and to rejoin the community or to find a safe environment. When we look at modern day stress, we tend to gravitate towards a negative stress response versus an adaptive stress response. So, negative response would be withdrawal and avoidance, isolation, emotion driven eating habits, dependency on alcohol or substance. And then positive response would be movement, breathing, social interaction, something, maybe a creative expression. Um, so it's worth just asking yourself, doing that again, that little internal reflection of during times of stress, what is my response? And then last on our pillars, we have that creating a sense of purpose and joy. So again, this is very prevalent to me as a practitioner in my conversations with people, especially people in chronic pain. Um, our worlds become very small when we start to lose physical fitness or when we're limited by health parameters. The things that bring us joy, community interaction, those are often the things that we sacrifice first. And that has a huge detriment on both our physical and mental health. Um, so just to kind of wrap up, four pillars of a healthy mind, we have awareness, connection. Insight is really important. So it's what is our internal narrative? Like what are we telling ourselves? We're wired often towards a negativity bias into a lot of self-criticism. And then really having an understanding of what does bring us meaning and purpose. I did include here tapping into your potential. And I think a lot of us could benefit from this is a survey that will allow you to look at what your character strengths are. And it's kind of fun to go through the survey and then you populate a list of like your top 5 character strengths. And that can help direct some of your like searching for sense of purpose when you have an understanding of what some of your own strengths are. All right, I know I thank you for sticking with me. I would like to open up the floor to any questions. If you want to share anything that resonated with you, any feedback, I'd be happy to just have a conversation for a few minutes.
Well, you put such a huge amount of stuff in there, it's kind of mind-boggling, but wonderful. And are you planning to continue doing this?
Yeah, so I mean, this is in its infancy stage, the program. There's a lot of direction we can move in. In putting this together, I realized just the wealth of information that there is to be shared. So I would love to then break down the pillars. There could be a kind of discussion series on each. So we could do a session on exercise and fitness. We could do one on nutrition. I'm open to feedback on that. I think there's a lot of information available, and if the interest is there, I'm happy to continue. Um, this monthly session will be done every Wednesday, the last Wednesday of each month for the foreseeable future, and will be on a different topic. So that plan, put that in your calendar. This is something that I'll continue as long as people are interested in joining. So.
And I was curious about the individual coaching sessions and how that all works.
Yeah, so for anyone that's interested, feel free to email me. And what I've been doing with clients, we'll set up like a an introduction, either phone call or Zoom session, where we kind of just chat and figure out if it's a good fit or if it's kind of the direction that would be helpful to you. The one-to-one coaching sessions are done remotely on either Tuesdays or Thursdays. And then the schedule is flexible in terms of the time frame. So you can schedule a 30-minute, a 45-minute, or an hour session. It can change from week to week. A lot of people start with an hour session just to really kind of cover everything, and then we'll start to taper down as we're getting a better understanding of each other and what the needs are. The cost is based on the time frame. So if you're scheduled for a 30-minute session, it's a $60 cost. 45 minutes is 90. An hour is 120. That is private pay. Unfortunately, insurance right now does not recognize that service as a skilled need. Um, and then that's something I could just explore with you further if you have an interest. So feel free to shoot me an email. I do have openings right now on Tuesdays and Thursdays for coaching clients. All right. If anything pops up, everyone has my email, I hope. Please feel free. You can ask any question you want. I'm happy to just explore any of the information with you. I know it's a lot to digest. I think my main hope from tonight was that kind of awareness, creating awareness and getting us to start to just explore kind of our own status and having a little bit of a better sense of how to do that. So hopefully I sparked a little bit of thought um, in regards to that.
Thank you.
Thank you. That was a very helpful framework, although a lot to digest.
Right, I will. I've taken up enough of your time, so I'll let everyone get back to their evening. Thank you so much again for being here. Like I've shared, this is something I've just really wanted to delve into, so I can't do it without people that are interested in the information. So enjoy the rest of the week, stay warm, reach out with any questions, and if I don't talk to you, hopefully we'll meet again in a month from now.
Thank you very much.
Thank you, Catherine. Very
Hi,
useful.
Robbie. Thanks
Bye.
for coming.